people who have chronic diseases. So I have a question for Ms. McKinley specifically, because you work for Molina, and I don't know if you work specifically for Molina in the marketplace, because I know that they are in the marketplace right now, but what kind of discussions are being had about, specifically with the Affordable Care Act, changes that can be made and regulations that can be given to insurance companies to ensure that they're not restricting certain medications for people with chronic diseases. For example, I've had patients who haven't been able to get certain medications that they were needing because they were resistant to other medications, but the Affordable Care Act plans that were offered were only specifically for certain medications. They were blocking a lot of these more expensive, newer treatments that were coming out. So what kind of discussions are being had right now about how to improve that?
Well, first I'll say I actually work with all of the Molina plans that are offered here in Ohio. And second, I would say, unfortunately, you're going a little bit further above my pay grade. However, one of the things that it's part of the work that I do out in the community is we do seek individuals such as yourself. And for Molina, and I can only speak from the perspective of Molina, everyone else kind of has their own internal processes that are also governed by the state and internal insurance processes as well for those 5 managed care plans. For us, we do take very seriously the information, and there is, the state of Ohio does also send out a report that goes out to 1,100 individuals as well as providers and members throughout the state. So we encourage everyone to fill that out with your information, but also questions. And for you particularly, and for anyone else in the room who also is a provider who works with individuals who has these types of concerns, you should find your community engagement individuals within all of the plans. It is our job to then take that information back, feed that information to the departments who do work on those particular areas, because the only way any plan can evaluate and change or make any adjustments to the value-added benefits and the way that it exists is to hear from individuals such as yourself, as well as those patients that you work with, and getting that consistent feedback. That is then kind of cycled, and there is this process that has to happen as far as evaluating how all of that works. But I always remind people, since doing this position, not only to take the information in those particular questions of how do you make these decisions, who are the people who make these decisions, because this is my scenario of what isn't working, but also to push to your insurer the information of what is working, because we want to be able to really kind of know, well, this is something that we've changed this year in this particular plan. This has impacted people in this way in a positive, but also this is then leaving still out a segment. I was supplied with some brief information from Molina from the perspective that to remind folks, we as an organization are continuing to try to work to strive to improve what we do. But the only way that we can improve what we do is to consistently hear back from individuals such as yourself. So I will make sure I get you a card, and I will have cards up front. Unfortunately, the department who makes those final decisions, I am not part of that department yet, but we do need that type of information as far as what evaluation. One area I will say that we did discover with looking at some of the websites when looking at those marketplace plans, when they were discussing which drug coverages and which networks that some of the insurers worked with, some of that information was inaccurate. So that's also part of our quality control, to go back and check that information and make sure it's the most accurate result there. So there are community navigators, and for us what we call community engagement community engagement, but our community connectors who work individually with our Medicaid patients, and those are people who will have that direct one-on-one kind of questions to be able to work through those particular areas. And that is something that really goes for all of us with health insurance, is also becoming familiar with what are those avenues for you to seek information about your individual plan. You're not just going through member services, but understanding, do you have access to a 24-hour nurse line that comes with your plan and using it? Do you have someone who, for specific conditions, can answer questions regarding your plan for you? Just to share a quick personal story here, I shared this with Dr. Everhard earlier. For me, as I was starting to work on what I was going to say about this, watching on Friday kind of what's going to happen with the legislation and a whole lot of things going through my head, I recently on Wednesday went for a biopsy for a lump I discovered in my breast. And I got that unfortunate call on Friday that, yes, it was cancer. However, it was a form that, as you said, you know, if you're going to get cancer, it's a form that at least is very aggressively, easily treated. But that immediately sent me also to a conversation now, not only with my employer, but my insurer. So they helped me navigate through people who specifically understood and actually could walk through my particular plan and what the next several weeks are going to look like for me from the insurance perspective as I start to go through that particular journey. But that is where I think it's very important for us to also take that responsibility to get to know those departments within our personal insurance.
I'd also like to add just one thing to that. One of the reasons that I really want as much as I've fought with the insurance companies over the years, oh my gosh, I really want the insurance companies involved in this process and competing with each other in this process, because there are so many medications, the biologics, some of the chemotherapy medications that run tens of thousands of dollars, and the only way they'll be offered and available to us is if there is competition in the system. If this becomes a state-run, bureaucratic, bloated system, we're not going to get what we want. But if we have, like I say, the Medicare Advantage program, where you have various insurers competing against each other to administer this program, that's where we get the choice that we want.
We've got another question here.
Let me say that there is a formal system for evidence-based medicine. There's a Cochrane library that it's possible to query that and see what works and what doesn't. It's not perfect, but it's already there.
Okay, Janet, you touched on a question that I wanted to ask, and that was about the insurance companies that are involved. And we have two experts here from the insurance companies. You're discussing profitability. And I'm really curious to know, is there true competition in the marketplaces? And we're hearing so much about how insurance companies are backing out because it's not profitable. I think Molina is one of the few organizations that's seeing profitability on the horizon. But in your opinion, is there true competition in the marketplace? And if the insurance companies stay in and we continue with the ACA as it exists, is it going to be profitable in the future? And will more companies come in?
Do you want to start?
Well, like I said before, there's two. There's a Medicare marketplace, and then there is the ACA marketplace. And in the Medicare marketplace, there is quite a bit of competition, not only just because of the Advantage plans, but because of the Medigap plans. There's quite a whole slew of choices that you guys can make for your health care. As far as the marketplace goes, it's starting to shrink. As an insurance agent, I no longer service people in the ACA marketplace because I cannot make a living. So I do not offer that service to my clients because, frankly, I cannot make a living, and therefore I focus on things that I can actually provide services to people that I'm going to be able to feed my family.
And I will say also to that, and from a perspective of when I worked with Enroll America, that was actually a common phrase we would hear from a lot of insurance agents and insurance brokers. There are two parts to that, though. One, with the Affordable Care Act, that there was that allotment to provide free in-person assistance through the Navigator funding, in addition to some states that had a higher need were also then given people specifically to work on the ACA marketplace enrollments, Southwest Ohio being one of those, in which a government contractor was then brought in to kind of help people sign up for health insurance. So that was an area that was often within our coalition of working with those who provided enrollment, this kind of wall when we had insurance agents in the room, and then we had these other nonprofits. And it goes even beyond the ACA and kind of breaking through that dynamic of those who were working with individuals through Medicare, and then agents who were working with Medicare. In regards to the profitability and looking at the marketplace, it has continued to function and change over the course of its existence. Plans are, every year we often will hear also about the plans that are leaving, but the reality is there are also plans that are introduced as well. There are other people who evaluate kind of looking at what plan they're going to put in, because that is where the levels of competition start to occur. And saying we had, looking at maybe offering so many plans during one particular open enrollment period, going back, evaluating, and seeing now what additional plans may be added. So it kind of varies. Here, I will say I'm from Hamilton County. I live in the Wyoming area, so I'm still District 2. But one thing, looking at from 2013 to now, the number of plans have gone from roughly around in the 80s of choices to in the upper 50s of choices. So there have been some decrease. But some of that also came from insurers evaluating those plans and looking at this was not something that was being selected by individuals. So why was that not being selected? What about this particular plan wasn't being of value to shoppers? And how do we then take that and then reconfigure that money into a plan that perhaps is of higher value? So there's still going to continue to be that level of competition, but going back to, I think, what a lot of folks feel in this room is that you still also have to continue to think, how do we revise what is currently there in order to also continue to create a system that ultimately creates healthy outcomes? Because I think we've mentioned a lot about health insurance, but the reality is it's about creating healthy outcomes and understanding how this is going to be a tool to make ourselves healthier.
I think that one of our other pseudo-panelists here has a response to that, Karen?
Yeah, I think first off, we need to remember we're a free market, right? So we're going to have winners and losers. As long as we're a capitalistic organization around healthcare, you're going to have winners and losers. So some of what we're seeing is a byproduct of that. The Kaiser Family Foundation, who does bipartisan research on this, over 50% of the insurers in the ACA have been making profits. They are healthy and they are functioning. So what we've seen is a winning and losing based on capitalism and businesses making decisions whether to revise a plan, get in and get out. Now, the other piece of this, though, that's important is, I think in many places, maybe not all, but many places where there has not been as much success, you had a higher level of uninsured, so you had higher expense as there was a backlog of care to get people in. So that's a byproduct of us taking a very long time of continuing to kick the can down the road and not getting people access and coverage to care, right? So we've surmounted that hurdle. We've paid the price of getting to that place. Let's not lose it, right? We want to keep moving forward. So know that there have been carriers that are successful in the market. I would encourage all of our representatives to look at the states where ACA has been successful. There are states where it is going gangbusters and they're having great success. Let's learn from those. Let's take those lessons. Let's replicate success across the country. This is America. We're known for our ingenuity. What problem can't we solve, right? It can be done. So let's learn from those states and bring that success to Ohio. Ohio's actually had a lot of markets where there's been success. It hasn't all been a tale of woe. And again, often those areas tend to be more rural areas where there isn't as much of anything. They might only have Walmart. There's not a lot of competition because it's very tiny. So again, this is where the government steps in and then figures out in those areas where there's more of a dearth, how do we solve that problem? And again, find a way to make it successful, profitable for someone in that area to actually make a living, because there's people living there, they need coverage too. So I would again encourage our reps, look at the successes, let's replicate those in Ohio. It has not all been a disaster, but it's also not all been a success. So let's build on the successes and keep moving forward. Single payer, universal coverage.
Okay, we've got a question back here.
Hi, my name is Kate Galligan, and I'm with United We Stand, which was the Women's March on Washington. That's right. 14,000 people in Cincinnati came out and showed up for human rights. I have a statement and two questions. One goes to the political will of us as Americans in fixing this problem. Although we grassrooted our asses off to stop the vote on Friday, we can't exactly see that as a victory because it was defeated internally by the Freedom Caucus. It wasn't extreme enough for them, right?
Right.
Okay. But a good thing about that, what it revealed, was that 17% of the GOP is the Freedom Caucus, so 17% of the extremists are controlling that conversation. Here are my questions. One goes to Dr. Ruppnagel. Can you explain really simply the differences between single payer, universal health care, and Medicare for all? He can do it. We've had this conversation over lunch many times.
Single payer means that all medical care is paid out of a single public fund. At the moment, it's paid out of a fund that contains both insurance companies and the government. So single payer is and Medicare is a single payer system. The overhead for single payer is less than 3%. The overhead for Medicare is less than 3%. By overhead, I mean the overhead. and for commercial insurance, it's 20 to 30%.
Right.
Kate, what was your other question?
Yes.
Universal means everybody's covered. Everybody's in, nobody's out. And that's the way it is with Medicare, too. Pretty much.
Thank you. Here's the next question. So we know there are massive problems in the ACA. And I think this question has been asked twice before, so I'm not sure on the panel who should take this, but is there any action in the pipeline for legislation improving the ACA? Is there anything?
And I'm going to kind of address that. And so one thing I think we also want to be very careful of when we are discussing things, the reality is there are problems, but there are not massive problems. So we have to also watch how we address certain things when we're discussing that, because it then can lead to sometimes misconceptions in regards to what's occurring. In regards to some of the legislation that is being proposed, I know Dr. Everhart has mentioned one of the bills that is 676 that is currently a piece of legislation. But the key part for that is I think that is also part of, that is a question that you put in your phone calls, that you put in your letters, and you put into your actions, because the reality is, you're right, this has not been now this is a done issue. Those representatives over there from both parties are equally responsible in making sure that there is still continuation to work on something that was created, and that we continue to move forward in getting that legislation to be something that is beneficial to a larger segment, as well as maintaining the benefits that have been accrued through other segments of our population. So that's something there, and I think Dr. Everhart will give you a little bit more about what's been proposed.
I just want to say that the institution of the ACA was a grand experiment. The insurers didn't know what to expect. None of us knew what to expect. And I see everything as a journey. We're always on constant improvement, streamlining, making a more simple, elegant system in any, especially in government, with the bureaucracy that we can build up. It's a journey. And there are not massive problems. Don't buy into that line that your Tea Party has fed the country. Don't buy into it. But there are things that need to be fixed and improved, and that's across the board in anything in government, as far as I'm concerned.
All right, we've got another question in the back here, or anyone have a response? All right, here.
Yeah, I'm Susan Bensinger. I live about 2 or 3 miles from here.
and I was at that march downtown in January as well. I had a big aha moment a couple of days ago about the AHCA, and that is that was in no way a health care bill.
No.
That was a tax bill.
Yes.
It was a tax bill. And the Speaker of the House has always been a tax wonk. That's kind of what gets him up in the morning, apparently. And so my comment to Messrs. Wenstrup, Brown, and Portman is that what are we going to be seeing from their august houses of Congress in the way of tax legislation that's going to have an impact on what we're talking about today. And to all of us in this room, any bill that comes out of the House, I didn't do it, honestly. Any bill that comes out of the House, because I believe that's where tax bills originate, isn't it? Whether it's got the word tax in the title or not, is going to be a tax bill. And that's how I think we should expect the ACA to continue to be chipped away at. That's what happened with the risk pools. That's how they're going to continue. The HCA was about giving money back to the insurance companies because of the tax benefits that had been taken away on salaries of insurance company executives. Just for example, that's not all of it, but it's part of it. So taxes.
I've got a couple questions over here. All right, well, so we've got some messages for Mr. Wenstrup, Brown, and Portman, and I've got a couple more questions over here.
We've heard the criticisms of the ACA couched in terms of there are all these people who have deductibles that are too high, or there are people who can't afford to buy insurance and then they can't afford the penalty either. But we've also seen that the president and other elected officials are asking for anecdotal evidence of the failure. Is there anybody who has actually collected any information about how many people are declining health care because they can't afford their deductibles or going into bankruptcy because of medical expenses? Is there any information about the number of people who can't pay the penalty and can't afford insurance? Do we have that anywhere?
Show the data.
Yeah, and then my other question is that because of that concern that there are people who can't afford the ACA plans, my fear is that someone's going to come forward and basically say we need to give people the choice of something that we've tried before, the equivalent of catastrophic care plan, which is basically no insurance until you're dying. And I'd like to hear, I know logically that doesn't work. I'd like to hear more specifically about why those really almost no coverage, inexpensive insurance plans are in fact something that we don't want to go back to.
One thing I will definitely say in regards to those catastrophic plans, because there is a catastrophic plan option on the marketplace as well. It was set up for individuals who were younger to pull them into the marketplace to kind of spread some of the risk pool, as it was kind of, they knew essentially the first people rushing in were going to be kind of the sickest of the sick. And that kind of making this more desirable to bring in more healthier young people. In regards to looking at moving backwards and creating something like a larger catastrophic plan for everyone, that still comes down to, like I said before, and I will continue to say, the ACA has created a bar. It is now, this is our minimum point, and we have to move forward. Anything that's being proposed that takes us backwards or removes certain health benefits has a larger detrimental effect beyond just the health of that individual. The reality is healthcare and a healthy individual impacts work. It impacts services and things that you participate on a daily basis, because you don't necessarily know how many people are there or not there and what impact that's having on that organization and the bottom line in regards to jobs and employment. Healthcare impacts schools, education. A child who doesn't have access to healthcare is less likely to succeed than an individual child who does have access to healthcare to be able to be a healthier individual. So those are those parts when looking at that legislation. And I feel like your question goes back to some of the other questions here of what is being proposed, what is now being talked about, that we still have to stay vigilant and continue to work with our individuals, not just from our national legislature. I will also remind folks, do not forget about the state and what role the state has and what comes to those of us here in our various counties. That is also a very critical point to remember. And one of the things I learned when I was taking my insurance class, there is no national department of insurance that oversees insurance. There is your state level department of insurance, and that is the entity that my license is answered to, and kind of the things that happen in your state. So that's also really important as well. But we first have to also educate ourselves. Senator Brown has said that he has some ideas. That's amazing. It's fantastic. And Senator Brown, we can't wait to hear those ideas from you. And I hope to Representative Winstrup and Senator Portman, we also still need to hear your ideas as well. It's moving beyond just criticism and praisal and all of the things. We want to hear your hard ideas and your actual, this is what I'm proposing, and the why. Because I know for me, at work, whenever I ask a question or I want to do this, I got to explain the why. So we want you to explain the why too, and what you project, and work with those areas you have access to be able to see what that's going to mean for us here in Ohio and here in the country. So that's what I would say to those in regards to the catastrophic plans, just making sure that we see if there is additional legislation that's being proposed and that's taking us in that direction. And once again, for our representatives there, we need to hear from you in regards to what's next.
We've got another question here.
Thank you. Jim's Faith. I'm from Claremont County. I have a comment for the Honorable Representative Winstrup. I voted for neither Clinton nor Trump. I followed my conscience and I wrote in Bernie Sanders' name. He's for universal health care, single payer. We shouldn't even talk about fixing the ACA. We ought to be going right for single payer. Anyhow, Mr. Winstrup, I just wanted to remind you that when you and your colleagues decided to replace Obamacare, you showed the public what you were going to take away from them. You started a runaway train for single payer. And the more you try and take away in the future, the more Mr. Trump's fake media is going to tell us all about what you're taking away from us. And that train is going to go faster. Thanks.
I think we've got time for a couple more
It's going
questions.
to go faster because the system is imploding.
All right, we've got a question here.
And this is a question that I have asked Mr. Winstrup already. So because of the vote that happened, I personally didn't feel like it was, not that the grassroots isn't good, because I think now that's all coming to light, but it happened because of the Freedom Caucus. And so I called the office on Thursday and said, I want to know, what are your tallies for your phone calls? So that's what I want to know from Senator Brown, Portman, and Winstrup, because he says he's representing us. So I want to know, what were your tallies from the emails, the phone calls, and the letters for and against? Many senators have released those tallies. And yes. And so the poor little person that was answering the phones, he didn't know that. And he said he would find out. And I said, well, I will call back and find out again as well. I often stop even when I'm shopping. So I want to know, because you do represent us here in this area, and I want to know what those were. So I think what you said was a valid thing. What is the data? Because I do hurt for those people that maybe can't afford insurance, that might be hurting because of the ACA. They deserve insurance as well. But what is the relationship of that, and what are you going to do, like you said? What are your ideas now to fix this. Rand Paul, of all people, was talking about bringing forth legislation for, they talk about going across state borders. So maybe that's what we need to do. I don't know. Do we fix it? I'd be on the single payer bandwagon myself. But that's my question is, what were your constituents saying to you? I feel like as a constituent, I have a right to know that.
We're going to take one last question, and then we're going to wrap up.
I think we've demonstrated today that we can have a polite, calm interchange, a constructive dialogue, and I'm asking Senator Portman, Senator Brown, and Representative Winstrup, will you please pledge to hold a minimum of 4 town halls every year? You can have one in each quadrant of the state for the senators, one in each quadrant of District 2 for Representative Winstrup. Let us give you our ideas.
I'm going to wrap up now. I think maybe our panelists might stay around a little bit. I wanted to thank the League of Women Voters of Anderson, our moderator, Kat Lyons, ACTV, Vicki Earhart of Anderson Township, who helped us manage this whole event, arranged it, and Amy Meyer, who is the events coordinator for Anderson Township. Stanley Jones in the orange shirt over there, he's been our go-to guy for the sound system, so we appreciate that. And we also have had some success or some interesting articles from the Community Press and the Cincinnati Enquirer and District 2 Ohio Indivisible. And a very special thanks to our wonderful panel for giving up their Sunday afternoon. This town hall will be rebroadcast on ACTV. Go to actv.org for schedules. And you have to be in Anderson, unfortunately, to get that. And please, don't forget to put your file cards in the box. If we didn't get your question, we've got cards out there. All of these things are going to be delivered to the 3 folks who did not show up today. And the last thing, a little plug for the League of Women Voters. We published this publication. It's called True. They Represent Us. And it has all the elected officials in Hamilton County. I'm also told that if you live in Claremont County, you can go to LWV Claremont.org, and they'll have a similar one for all your folks in Claremont County. There's information about the League of Women Voters if you want to join. I certainly would love to have you, and we're not just for women. My husband is a member, and I see a couple other husbands here who are members, and I want to thank you all for attending. We truly appreciate your civic engagement. Thank you.